Now, Madam President, I just got back from Albany and Syracuse, where I visited two of our community health centers, the Syracuse Community Health Center and the Hometown Health Center in Schenectady. These community health centers do amazing work, amazing work. They provide good, effective, efficient health care for so many people. In New York State, about 2.4 million people get help from the community health centers. In central New York that I visited in Syracuse, about 80,000. In the capital region where Albany is, 110,000. And let me say, Madam President, that when President Trump instituted his freeze, his funding freeze, it sent shockwaves through these two centers and hundreds of others across the country. All of a sudden, payments frozen, funding frozen. No reasoning, no logic, nothing. They wondered, do they have to lay off people? Could they pay the rent? They wondered if they could give health care, for someone who had a 2-week plan. Maybe the doctor shouldn't prescribe it in week 1 because he wouldn't be around. Money wouldn't be around in week 2. They depend on federal funding. They get somewhere between 15 to 20% of their funding. They've been going on since the 60s and delivering great, efficient health care. And all of a sudden, this funding freeze drops on them like a ton of bricks. And it wasn't just community health centers. Veterans organizations, mental health organizations that provide mental health help for people. Head Start in Western New York, 2 of our Head Starts in rural America, in rural Western New York, closed. And 200 families had to struggle to find what to do, because, when you're a single mom or a single dad, or even a mom and dad, 2-parent family, and there's nobody there watching the kids, there's no Head Start, what are you going to do? Should I stay home from work, maybe risk salary being docked, even losing my job? It was horrible. This occurred across the country. Now, thank God people rebelled. Thank God people made their voices heard. And the funding freeze was rescinded. But the damage still is there. There was a health care center where I visited in Syracuse. This one was in the Mohawk Valley. That funding, $71,000 on a thing they were building, stopped. 5 centers in Virginia closed. And funding is still intermittent in health care centers throughout New York State and throughout the country. Cruel, unfair, awful. These programs help people. No, they don't help the billionaires. I get it. But they help average folks and poorer people get the health care they need. They help them see a doctor so that preventative care can happen, which we all know saves us money. They're a shining example of public service that does enormous good for millions of families. And to anyone who says that these are examples of inefficiency or waste, visit one. Visit some of the scores of them that are in New York. They're the most efficient, effective deliverers of health care in the country. They serve people who need it the most. And they're effective. Instead of going to, if your kid, let's say you have 3 kids, you're a single mom, and your kid has 104 fever with probably strep throat, and you got to see a doctor before it gets worse. You go to a community health center, you don't sit in a waiting room for 6 hours and have to file endless papers like you do in a hospital. They take care of you right away. And it makes it a lot easier for people to get health care, and it makes people want to get that health care that their kid might need. And yet we're still hearing it. These great health care centers, funding delayed, funding not coming, funding late. And they depend on this funding. They don't have a 6-month plan. They get funds from the federal government every 2 weeks that pays the rent, that pays the salaries, that buys these supplies they need. You shut it off for a week, and the whole thing could face a real problem. And so I went to Syracuse and Albany and demanded that, number one, this administration say they're no longer fooling around with the money that these community health centers need, that they get it right away. Two, they give an explanation as to why it was cut off. What'd they do wrong? Help people get health care that they need? And third, we Senate Democrats are demanding that the funding for these centers overall, which runs out on March 14th, because as you know, Madam President, there was a bipartisan agreement to fund them fully for the year, Democrats and Republicans, and Donald Trump and Elon Musk said, even before they were in office, Musk is not in office, but before Trump was in office and Musk was working with them, they told the Republicans, don't fund it. Don't fund this health care package. And so now we're waiting until March 14th. But that is a CHC, a community health care center cliff. If we don't renew that funding, many, many will close. Millions of people in America who are getting good health care, often preventative, often dealing with the immediate problems, will not get it at all. So those are the three things. Stop fooling around with the funding. Keep the flow going. Number two, explain what anyone did. Why did they stop this funding? And third, fund us so we don't go over the health care cliff. This was bipartisan. My guess is you, Madam President, probably supported it. But when Donald Trump and Elon Musk said, get that funding out, kill the deal, that's what Republicans did. I made it clear in Syracuse and in Albany that this cannot happen. It's infuriating, and it has nothing to do with inefficiency. Our hospitals, by the way, our big hospitals like CHCs, because that means their emergency rooms are not overflowed with people who could be taken care of in a much more effective, efficient way. So I want to make a final point here. We hear from Donald Trump, J.D. Vance, Elon Musk, and DOGE. All they want to do is get rid of waste and inefficiency. When you look at community health centers, that's utter nonsense. Utter, utter nonsense. There isn't very much inefficiency at them. No one has ever said that they were inefficient. In fact, most people who look at it say they're the most efficient providers at a lower cost, with less to do in health care, less paperwork, less all of this than other places. So anyone who thinks that this DOGE experiment is simply at getting rid of waste, baloney. Baloney. We know what it's about. Cut. DOGE is using a meat axe and cutting things that are vital to people. Why? Why is all this happening? Because a careful look at inefficiency in government, even with a new administration that might want to look at it a little differently, would not just cut everything. Not just cut everything. And the bottom line is, it's all to cut as $2.5 trillion, $2 trillion. We know what they're doing. And unfortunately, too many of our Republican colleagues are going along. They're making these cuts so they can give the very wealthiest people in America a bigger tax break. Take a working class family that's getting health care and say, you don't get it anymore, so Mr. Ultra Billionaire can get more tax breaks. Come on. That's what's going on here. And it's across the board. We saw what they did with AID. Well, one program AID is working on, as I understand it, is dealing with Ebola in the middle of Africa. It's cut out the program. What if Ebola spreads around Africa and even here? Most people think that's a very good program. Most people thought PEPFAR did a lot of good. But they cut it all. They didn't point out and say, this is inefficient and that is inefficient and cut it. But let's keep the good stuff. Cut it all. And we know why, once again. It's because the billionaires want even a bigger tax break. So my visit to CHCs, the two CHCs I visited, hometown in Schenectady and Syracuse Healthcare in Syracuse, were very moving to me. I saw dedicated people who want to help people. I saw patients come in and get decent health care. And yet, it's on the chopping block. That's not what America voted for, Madam President. That is not what America voted for. So I hope we will have a bipartisan coalition to fund our health centers. And I also hope that this administration, whether it comes to community health centers or so many other good programs across the board, will not freeze their funding, will not just say we're cutting you, will look at things carefully. There is inefficiency. Use a scalpel. Get rid of it. But don't cut everything. And again, it seems the logic is very simple. They're really not interested in making the government more efficient. They just want it to cut a certain huge amount of money. They don't care where it comes from, 2.5 trillion, 2 trillion, 1 trillion, regardless of the consequences for working families. It's a shame.